What exactly goes on during a typical meeting with you?
Well, if I haven't seen anyone before, I try very hard to, get them, have them, be comfortable. And I always talk about the confidentiality as soon as I can, and just let them know that whatever we talk about is just between the two of us, including their parents. The only way I could talk with someone is if they would give me written permission to do that. And then I tell them what the exceptions are. If somebody's suicidal, homicidal, or if there's any other sort of dangerous thing going on, there are the exceptions that I can, notify somebody.
So if the situation does escalate to the point where, somebody's about to jump off the building, even if you don't have that written consent, you're able to go to a parent or a guardian or some other source.
Yes, we would have to do an intervention if somebody was in danger.
So what do you feel is maybe the most extreme situation that you could handle? Where would be the point where you would turn it over maybe to a hospital or some sort of other institution?
Yeah, well, every year typically I will hospitalize 2 or 3 students, and usually that's when they're not safe. They're talking about suicide, they're thinking about suicide, and they're just not willing to do what needs to be done to keep themselves safe. I've never really had to hospitalize someone against their will, though. Typically, they agree to go in because they themselves know that they need help. The thing about hospitalization is it's not really going to help them. It just keeps them safe. I mean, they don't do therapy very much, you know what I mean? It's more just kind of a safety thing, and then after they're discharged, we have to, figure out a safety plan for them, and I have to keep pretty close contact with them.
So if it doesn't escalate, to that point where you need hospitalization, are you able to give a student a prescription for maybe a drug or give them a referral to another professional?
Mm-hmm. There are a lot of students who come into college on some sort of psychotropic medication for anxiety, depression, bipolar, whatever. And then sometimes throughout the year when a student is really, really having trouble, and the way I handle that or the way I judge that is if whatever it is that's bothering them is getting in the way. In other words, if they can't get out of bed, they can't do their homework, they can't concentrate, they're just a mess, then we will discuss the possibility of medication. And I'll give them some education about medication and what it does, how it works, blah, blah, blah. But I myself can't prescribe because I'm not a doctor. So I give them options. Our doctors at the college, we have actually a new group of doctors that have come in this year, and they're excellent. And they're just excellent when it comes to evaluating and doing an assessment. Typically, I'll see the student, I give them some checklists, I write up kind of a paragraph or 2 about the student, and then that goes down to the doctor. Then they look at all that and recommend or not recommend.
Talking about appointments, how exactly do I go about making an appointment if I ever do need to see you?
Most kids do it by email. Most kids just email me. Every once in a while I'll get phone calls, but I would say the majority of kids email me. Or sometimes what they'll do is they'll just walk into the health center. I've had a lot of that this year where they just walk in and, want to see me right away. They're sort of, in crisis. But, they can call me, they can email me. Judy Duda down at the health, the medical staff down there, she sets up appointments for me. Lots of times I'll get professors calling and wanting me to see a student. Not lots of times, but sometimes I'll have a professor sitting in his or her office with a student, and they will call together to make an appointment. The professor sees that they need help.
All right, well, those are all of my questions, unless you have any closing comments that you'd like to throw in there that we haven't mentioned.
I would just want to encourage somebody if they're struggling, no matter how small they think the problem is, they're welcome to come, I'm very happy to see them for whatever.
So the only thing I need to ask of you is, where can I find you and how can I contact you? What's your number? What's your email address?
Okay, it's Quincy B.I. at Westminster. My office is located in the health center, and it's kind of way back. You go through the health center waiting area, and then you walk way down the hall. So it's pretty private.
All right, and that's everything that I have. So for more information on the Health Center, check out www.westminster.edu/students/health center/council. Thank you, Babs, very much.
You're welcome.